If you were told your tubes are blocked and nobody explained where or why, this video is for you. Because not all blocked tubes are the same. There are two main areas where fallopian tubes can become blocked. Proximal blockage, which is closer to the uterus, and distal blockage, which is closer to the ovary near the end of the tube. And understanding the difference matters because once you understand why the blockage formed, everything starts to make more sense. Now, proximal blockages are often more inflammatory and functional. That means they can be caused by things like chronic inflammation, estrogen dominance, mucus congestion, immune activation, swelling, or even tubal spasm during the HCG itself. Sometimes the tube isn't sealed shut the way women imagine. Sometimes the tissue is irritated, swollen, narrowed, or congested. Now, distal blockages are usually associated more with scar tissue, adhesions, endometriosis, pelvic infections, surgery, chronic pelvic inflammation, and hydrosalpinx. The distal end of the tube is very delicate, and when inflammation sits there for months or years, tissue can become sticky, the fimbriae can seal, and fluid can build up. But here's the part almost nobody tells women. Even though proximal and distal blockages can look different, the underlying terrain is usually very similar. Inflammation, hormonal imbalance, poor circulation, lymphatic stagnation, immune overactivation, congestion in the pelvis. And that's why my approach focuses on changing the environment that caused the blockage in the first place. Because fallopian tubes are living tissue, and living tissue responds to environment. When inflammation rises, tissue swells. When circulation improves, tissue receives oxygen and nutrients again. When inflammation calms, congestion softens. When scar tissue remodeling is supported, adhesions can begin to change over time. The body is not static. And this is where so many women lose hope too early because they were given a diagnosis without an explanation. They were told blocked, but never told why. And when you don't understand the mechanism, everything feels permanent, but biology responds when it's supported. Now, that doesn't mean healing happens overnight, and it doesn't mean every woman is identical, but it does mean your body deserves more than one sentence and a referral to IVF. Do you know someone who wants to have a baby but is having a hard time getting pregnant? Maybe I can help. Go to ftfsystem.com and start with the FTF 3-pack. I've helped hundreds of women. Maybe I can help you too.